Hello, good evening, and welcome to the first ever episode of Healthy Baat, an initiative of the Essex Indian Charity, a registered charity working for the holistic well being amongst the Indian diaspora and the larger British Asian communities. Founded by like minded Indian expats more than a decade ago, today Essex Indian benefits from having more than 200 members. Our core mission is to create a sense of belonging among second generation British Indians to both the British and the Indian culture they belong to. Throughout the year, EI celebrates cultural festivals like Holi, Saraswati Puja, Durga Puja, together with the people gather and celebrate as they would do at home. At the same time, we hold food and folk festivals and East Meets West events where the community participates together. EI actively supports young people in learning and being rooted to their culture and language through the online language classes, gives them opportunity to learn more about the Indian culture through art and music. Simultaneously, our community outreach programs focus on both physical and mental health through regular health checkups, badminton club, walking club, etc. It is an extension of EI's focus on community health and well-being that we have initiated Healthy Baat, a series of conversations with physicians and subject matter experts answering health related queries sent by the people across the community. I'm your host, Meghna Das, a public health and development professional for nearly 2 decades, and tonight I'm in conversation with IVF myth and reality with our own Dr. Professor Arpita Ray, consultant gynecologist and subject specialist reproductive medicine and in vitro fertilization, and also trustee of the Essex Indians charity. Please welcome Dr. Arpita Ray.
Hello, hi Meghna.
Hello, hi Arpita Di.
How are you doing?
I am doing fabulous. How are you?
I'm very good. Very good. So let's start Healthy Bath, the very first episode, isn't it? I'm very excited to be here as kind of the launching episode of Healthy Bath. How are you feeling?
Oh, I'm extremely. I think my nerves are acting up. We've had such a good response from the community. We've had so many people coming up with questions. I think I would also take this opportunity to give a brief about um, the outline of the program. So, over the last 2 or 3 weeks, after we launched the session, we've had a lot of questions coming in from the community members about IVF and what they would like to know from you. And in the interest of time, how I would like to go about is I'll ask the questions. All these questions are anonymous, um, and we'll take the conversation from there on. Over to you, Arpita.
Fantastic. Looking forward to all your question. Before we start the conversation, I would like to give a disclaimer that I am not doing it for any advertisement purpose, and also there is no financial gain from this healthy bath. So over to you, Meghna.
Right, thank you. So we have received some questions and queries over Facebook and Instagram Messenger. And we have, in the interest of time, clubbed some very similar questions for the first episode. So we shall start. The first question is how to prepare your body for IVF.
Right. Okay. Very good question and very good beginning, I would say. And if I say, rather than saying IVF, I would say how to prepare your body when you are trying to have a baby. Because everybody trying to have a healthy baby, they all knew that healthy baby obviously needs a healthy mom and healthy dad. So essentially, the way the UK system works, essentially, when someone is trying to be pregnant, we always advise avoid smoking. That includes vaping as well, because it has been seen, though when the vaping first came up, we all thought this is probably a very good alternative of smoking. But it has been shown that the strawberry flavor and the gum flavor of vaping, those liquids,
Odds. Yeah.
liquids, they have some bad impact on the semen or the sperm quality and quantity. So therefore, we always counsel people saying that if you are non-smoker but you do vape regularly, please bring down your vaping, and as well as you don't use those kind of liquids. Similarly, alcohol, minimum occasional. I'm not saying anyone to kind of go complete teetotal and get stressed because of that. You are always be able to celebrate Christmas with a glass of wine, or you will be able to celebrate your 30th birthday or 35th birthday or 40th birthday with a can of beer. So that's not a problem. Healthy weight, that's most important thing. You will probably tell me like, Arpita Di, I see a lot of people with higher BMI, they are falling pregnant. However, when someone is trying for pregnancy, as per NHS rule, they have to try for 3 years when there is no reason found in the investigation. If there is any reason found, then essentially it's 1 to 2 years. Your BMI needs to be less than 30 if you have to have a NHS funding. If you are going in a self-funded route, then most of the clinic will accept BMI around 35 or around like that. And the reason is, any fertility drug has got its own side effects and can cause clots in the legs or lung. And that's quite a serious complication. And also, the drug absorption during your fertility treatment gets affected by the BMI. So that's why we always advise, try to keep your BMI if you're coming for an NHS funded fertility treatment or self-funded route, but try to bring it more towards 30, and your success rate will be better than when your BMI is 35. Similarly, if you have any serious medical condition, try to optimize it, because these days the medical science has advanced so much that we will see a lot of people with complex medical conditions. They will lead a very normal life, but they need to be very aware that when they are going to try for fertility treatment or become pregnant, pregnancy can alter that equilibrium. And therefore, optimizing your medical condition is very important. Getting a letter of support from your relevant consultant before coming for fertility treatment is also very important. And we also advise people, those who with complex medical condition, we always advise to have a pre-pregnancy counseling, which makes you more aware of the risk, effect of your disease on the pregnancy, effect of pregnancy on the disease, as well as the effect of disease on the baby. So those are the things we always say. Healthy diet, junk food, we all know that's not great. For men, if you are going to look after your sperm, probably avoid hot bath, sauna, use shower. If you are wearing very tight underwears, use loose underwears, and keep moving so that that area is much more gets more air and it's cooler. So these are the common thing we normally tell. Decaffeinated tea or coffee, that's something you can try. They're not that bad, because I normally drink decaffeinated coffee for my history of palpitation, but it's actually good. But some people who wants to have the kick from the coffee might say, no, I won't go, and they usually feel sad when I tell them avoid caffeinated drinks. So does it answer your question? You are muted.
So I think that is quite extensive. And I hope that answers the question for the person who asked this. The next question that we have is, what are the 5 stages of IVF?
Right. Okay. So the IVF treatment, obviously, there. If you look at the, I don't know whether you have watched the movie Joy in Netflix. It's all about IVF, how IVF came. Essentially, it's quite interesting. So when IVF came, it was to start with someone, Louise Brown, the first baby born by IVF, and her parents had infertility, and it's all related to blocked tube. So that was the primary indication of IVF treatment. So essentially, when a couple comes to see someone for IVF treatment, they will be having a consultation with the doctor, and at that point, the doctor will take their full history. By that time, we also ask for a summary from their GP, because obviously GP summary gives us an idea about their medical background. Because what we notice quite a lot of time, when people are trying for a pregnancy for a little while, they are quite desperate, because they are otherwise probably living a more or less normal lifestyle, but they have that desire to fulfill, and that's why they are coming to the clinic or seeing in the consultant in the NHS hospitals. So the investigations that is needed, essentially, you need to have some blood test, the hormone test, to check your ovarian reserve, what we call anti-Mullerian hormone. Then ultrasound scan to check your uterus, your ovaries. Then you will need infection screen, because when you are having IVF, the specialist scientists, whom we call embryologists, they will be handling your egg and sperm, so they need to be safe. So therefore, infection screen for hepatitis B, C, HIV, HTLV screen needs to be done, and usually that is done in NHS hospitals with certain regulatory approval. So that's how those blood tests were done by the hospital or the clinic. You will need to have your up-to-date smear test, rubella vaccination, or what we call German measles vaccination, or immune status, because the importance of that is you will have rubella immunity and you will be safe during your pregnancy, and chlamydia screen. So these are the basic investigation you will have. Then you will see the nurse. Usually, the fertility treatment, the IVF treatment, mostly run by the fertility trained nurses. So they will see you, go through everything. You have to complete quite a lot of consent form, because UK is probably the one country in the world where IVF is very heavily regulated, which is good, because then the clinics or centers, they are always answerable to this regulatory body called Human Fertilization and Embryology Authority, and which is very good. So they have to, the patients need to, the couples need to complete essentially lots of consent form, and these consent forms are quite elaborate, and it talks about different scenarios, giving each other consent to use their own gametes. So once these consent forms are complete, you will start your treatment journey. There is a lot of time you might need to have some preparatory phase with pills or progesterone tablets for scheduling your timing, because the whole idea of IVF is we are upcycling all the follicles which is otherwise going to die in that cycle. So what happens in a woman's menstrual period, when they are having their period, by day 7 or 8, a group of follicle grows, and then naturally one follicle will take the clear lead and others will die. During IVF, by giving some stimulating injection, we are essentially growing all the follicles all together, and then you will have regular scan. We will give another injection to prevent premature release of the eggs, because the whole idea is we are trying to get as many eggs possible from that cycle. Then you will have a trigger injection which helps to release the eggs when you are having your egg collection. So egg collection is a very small operation. You usually go to the clinic. You don't need general anesthetics all the time. Most clinics in UK will be using what they call conscious sedation. A lot of people probably had it when they have some dental procedure, etc. Takes 10 to 15 minutes, and then you wait in the recovery. So essentially, we suck out all the fluids from the follicles which are grown, and then same day your partner or husband will be giving their sperm sample. If you are a single woman, then you will be using donor sperm. So whether it's a known donor or unknown donor, that sperm will be used. And then the clever people in the lab, they will create the embryo. You will then continue to take, if we get average 10 to 12 eggs, and you do not have too much side effects of the drug, you are not feeling very bloated, very sick, what we call ovarian hyperstimulation, then it's all fine. You will go home, you will start taking some progesterone suppositories or injection depending on your need, and then essentially the embryo will keep growing in the lab. We are allowed to grow embryo in the lab maximum up to 7 days, but we do all the transfer by day 5, because what happens, that is called blastocyst. What happens,
Yeah.
that is the natural time in your body that embryo will get kind of attached to the uterus. So that's how it works. And then that 10 days waiting period starts. If it's positive, brilliant. If not, then obviously there is quite a lot of heartbreak. We see those people back in the clinic, look at the previous cycle, what are the things we can change. Most of the time when it doesn't work, it's the most common reason is usually your body is identifying that something is wrong with the embryo, and that's the nature's way of kind of ruling out the abnormal pregnancy.
That's an interesting fact, actually. Um, the next question that has come through touches a bit on what we discussed to begin with. The question is, how does one maximize IVF success? And this is to do with the myths and reality.
Mhm.
Um, I think you and I both know that there are a lot of myths that is going around IVF. Um, about what people think would maximize your success. And one of the reasons that we're having this session is to debunk those myths. So, what would you think are some of these myths that are going around, and what is the actual reality?
Right. So the most common myth is, if I go through IVF, I will go home with a baby. That's not the actual fact. IVF is a gamble. It's like rolling of a dice. Most of the time, even if you have everything perfect, you are less than 35 years old, you have got good ovarian reserve, your partner or husband has got very good sperm, even then the chance of success will never be any more than 50%. And that's essentially clinical pregnancy rate. That means you have your embryo transfer, pregnancy test positive, 6 weeks time, you have a scan, and that scan positive. And from that scan positive at 6 week to delivery of the baby, there is also risk of miscarriage. So live birth rate, if you look at UK data, overall no more than 33 to 34%. So essentially, it's 50-50. It's, as I said, it's rolling of a dice. Also, second thing, irrespective of age, if I have IVF, I will have a baby. That's not true. Probably we are seeing in all these glossy magazines that the celebrities are having their babies at the age of 48, um, two babies, beautiful photos, etc. But female age is a very good, or the most important predictor of IVF success rate, because we all come with a fixed number of eggs when we are born. We are genetically programmed in that way. So therefore, once a woman start having their period, they gradually start losing their ovarian reserve. So when you are in your 20s or early 30s, the chance of success for IVF is maximum, because your egg quality is much better. You have got a higher number of eggs. So therefore, you will need less amount of drugs. Once you go past your 35th, 36th birthday, your ovarian reserve goes down, start going down quite steeply. And by your 40th birthday, the chance of success will go down very, very quickly. And also, equality gets affected. Males are very lucky; their sperm are getting produced every 3 months. So therefore, until the 45th birthday, the sperm doesn't show a gross change. But IVF success rate mainly depend on female age. And that's how it is reported. Because if you look into HFEA website, you will see age less than 37 years old, age above 38 years old. So there is a big difference
Correlate.
in success. Yeah. So these are the
Yeah.
two main kind of issues we have to face. Other than that, there is all these things. IVF creates abnormal babies. IVF causes cancer, and those kind of myth is there.
I just wanted to, it's like a tangent question. So when we say that it's linked to female age, would that also means if someone gets a egg donated to them, or if they are, if they're using donor eggs, or they have saved their eggs or frozen their eggs or frozen their zygote before, um, is age still a factor then?
No, because suppose someone, and which is getting quite popular these days, social egg freezing. Before COVID, we always used to talk about these topics, but it was a big social taboo. And it was like the clinicians should not be talking about social egg freezing because it's unethical. But if you look at the female, for a career woman's life, you are busy with your profession, you are busy with your career, you might not have met your Mr. Right, then this egg freezing gives you that choice, that when you are in your 30s, if you go through your egg collection, freeze your eggs, and then these 30 years eggs will be much better than when you are trying for a IVF treatment with your own egg at the age of 40. You have got much higher chance of success with those 30 years old egg than when you are 40 and trying for pregnancy through IVF treatment. Because one is the egg quality, is the DNA fragmentation inside the egg will be much less when they are young.
Oh, that that makes absolute sense. How many rounds of IVF do you think is normal?
um, IVF first cycle is like you are knowing how your body is going to respond. Normally, the cumulative chance of success goes up to 70 to 80% after three cycle. So but that doesn't mean that your chance is 80% after third cycle. It means if 100 couple or 100 women with the same kind of scenario goes through, suppose, the first cycle, probably 35 or 40 will fall pregnant. They go through second cycle, another 15 will fall pregnant or 20 will fall pregnant. So that means your cumulative chance of success is around 55 after two cycle. After three cycle, another 15 couple will fall pregnant. But if you notice, when I'm saying in your first cycle your chance of success is 35%, second cycle is around 20-25. So gradually, as you go more with the cycle, chance of success gradually goes down for that individual cycle, but cumulative chance of success goes up. So that's why we normally say that up to three cycle your chance of success goes up, up to fifth cycle, between third to fifth cycle, it's plateaued, and after fifth cycle, it gradually goes down. So if someone is trying for repeated IVF cycle, we will always counsel them like, look, you are trying, but look at the cost effectiveness, because NHS will fund only 2 cycles of IVF in this area in east of England, and most of the areas apart from Scotland, everywhere else is probably 2 cycle or no cycle at all. So I think when someone is going through IVF treatment, I know it's a desperate kind of attempt. You want to have a baby, but at the same time, I think sometimes it's important to have a pause and think more clearly.
Yes, and I think it's also very important to understand the financial aspects of IVF. Um, there are, of course, two routes of going through. You can either go through the NHS, or you have private options if you want to fund it yourself. Now, coming to the NHS, what is how do you refer yourself for an IVF um, program with the NHS? How do you go about it?
Yeah. So normally what happens if a couple is trying naturally, and nothing is happening over a period of 1 year, and they don't know anything about their fertility health, my recommendation will be go to your GP and raise it, because your GP has the capacity to do quite a lot of tests within the primary care setting. And if your GP is not keen in current NHS cost restraint situation, continue to nag your GP. And investigations the GPs can do is the normal standard hormone level, FSH, LH, semen analysis, ultrasound scan. And if those reports are all normal, usually your GP will say, no, keep trying, keep trying. And because in case of unexplained subfertility, your GP will say you have to try for 3 years. And only then I will be able, and they are not wrong, because that's the regulation from the regulatory body of the NHS, which we call ICB. So suppose someone has tried for 3 years and then has gone to GP again and said, I've tried for 3 years, then GP will refer you to the secondary healthcare setting, which is the NHS hospital. Then there is a waiting list at that point, because like NHS is stretching to its own limits. So you will see a gynae consultant who will go through all your reports at that point, and probably will ask you to do a tubal patency test, which is called HyCoSy or HSG. Once that test is done, if the test comes back there is some abnormality, or semen analysis or anything abnormal have been found out with your GP or with your consultant, then your referral will be fast tracked. But if everything is normal and your tubes are open as well, at that point what will happen, your secondary care gynae consultant will probably try giving you some tablets, for what we call Clomid or Letrozole, those kind of tablet, trying to make your ovary to function bit extra, or if you have irregular period, to regulate your period. That has got around 10 to 12% chance of success per cycle. You will go through probably 3 to 6 cycles of that. If nothing happens, your doctor will refer you for IVF. If the IVF funding is available in that area, and if you fulfill all the criteria, which means your BMI less than 30, you and your partner did not have any children in any other relationship. It can vary from different ICB. And also you both are non-smoker, you do not use any recreational drug. Use of recreational drug is a big no-no, and your treatment will be paused until you stop recreational drugs like cocaine, cannabis, and those kind of things. and you will be sent back to your GP to have welfare of, like, if there is any concern about welfare of the unborn child. So your GP needs to give you that letter of support, and only then you will be referred for IVF treatment at that point. If your secondary care consultant is very knowledgeable about the fertility pathway. Otherwise, lot of time what we see that we will get the people, we are taking the history, that time someone has disclosed that they have been using recreational drug, cannabis, cocaine, or anything like that. At that point, we cannot directly take you through the IVF. We have to refer you back to your GP, evaluate, getting the letter of support, etc. Now, hospital to tertiary IVF center, that waiting time is probably an year. Usually, most of the IVF centers, whether it's within NHS or in the private sector, they usually do not have a huge amount of waiting list, because NHS does not, most of the IVF cycles are offered in NHS through the private clinics who has got like the tender for providing fertility services like IVF treatment. So you, most of the cases, you will be seen in the private fertility clinic through your NHS funding. But from the point zero, when you have gone to your GP, if you do not have any issues at all, it's could be a quite a long process. And as I said, could be 4 or 5 years.
4 or 5 years. Is that the
Because the
wait time
GP,
or
because
oh
usually the GP is saying you have tried for 1 year, and GP, you have
ah
seen your GP, and GP is saying come back after 2 years. If nothing happens, then I will refer, because that's where the main bulk is. And then from GP referral to your secondary gynae care probably will take around 7 to 8 months. You have seen your consultant, in the secondary care, consultant have done the investigation, you have gone through 6 cycles of ovulation induction if indicated. So it's going to have to kind of altogether from GP to your completion of 6 cycle of ovulation induction is almost 1.5 year. Then you get referral to the IVF, and then the process is not that slow.
yeah, I
So
think then
right.
it starts moving. Yeah, then it starts moving as per plan and procedure.
Yeah.
um, so my next question is then, so this is for people who are going through the NHS. So
Mhm.
suppose someone wants to go and fund it by themselves, they're going to go through the private route. How would they choose a clinic? What are the criteria? Is there any standardization? Is there, how to measure the success rate of the clinic? Because I think that's one that's going to be critical. That you would like to, when you're picking a private clinic, you would like to evaluate the success rate, vis-a-vis another clinic. So how do you evaluate that?
I always say your go-to point will be HFEA website, which is Human Fertilization and Embryology Authority. If you put your postcode there and ask for clinic around your area, you will get all the clinics around your postcode, probably 10 miles, 20 miles. You will get those clinics, all the details and their HFEA inspection report as well, because that will be like 5 star, 4 star, and whole report will be there. So you will be able to know all those clinics' success rates based on your age. I would suggest look into the success rate of 40 years old if you are at that point 40 years. Do not look for a high success rate in a clinic who is essentially, or a hospital where essentially very high success rate for less than 35 years. Don't choose that clinic if they have a low success rate for above 38 years old, or if you already know that you need a special type of IVF for some reason or other, like for male factor infertility, for one example, Look at the success rate of ICSI, where the male, if there is problem with the sperm, essentially you will see ICSI will be the treatment of choice most of the time. And look at the success rate, look at your age specific group, look at age specific treatment group, and you will be able to find out the success rate as per those categories. Also, if you are shortlisting certain clinics, go and visit those clinics or hospitals, because most of the hospital which has got fertility unit or most of the fertility clinic, they do open day or open evening. It's important you go and visit and get a feeling about that clinic, because it's about, you want to feel comfortable because you are going through a very critical part of your life's journey. You are otherwise fit and healthy, most of them are, and you are probably very successful in your life, in your career, etc. This is a desire you are trying to fulfill. There is nothing wrong with you. You want that you will be surrounded by caring people. You do not want to be a number in their fertility
Success story.
portal.
Yeah.
Also, locality. You lot of people, lot of clinics have satellite clinics in local area, but then a main clinic probably in central London. Think about the treatment you are going to have. What you do not want is essentially having a procedure done and then coming back home in the public transport. Think about those things. Talk to your line manager, the person you are working with. There is a charity which is called Fertility in Workplace. That is a good charity website to look at, because nowadays fertility treatment and having a supportive employer is very, very important, because it has been neglected for a long time. So I would say, when you are looking or choosing for a clinic, go to HFEA website, visit the clinic, and then look at the facilities, how it fits with your life, with your work commitments, and then choose your clinic or because NHS funded treatment, obviously there is choose and book opportunity, but mostly there are fixed hospitals or clinic where you will go. But
Yeah.
when you are, and especially in around London area, there is more choice. When you are going outside London, there is limited choice.
I think that's a very pragmatic approach to have as well, because people forget that while you're going through the IVF process, you will be visiting the clinic many times, and every alternate day or every 3 days, you'll be going in for your egg monitoring or uh, any other processes. And if it's not convenient for you to travel, then you might have to rethink your clinic. Um, and sometimes putting a focus on such pragmatic issues is also important when you're considering your fertility journey. Um, the other question that I have from a guest is, we've heard of the Zika virus, and we hear from a lot of people that when they're going through the IVF process, if they have visited a country which is known to be affected by the Zika virus, then they're asked to wait a certain period of time, or to have a certain test done to understand if, So, what is the causality? What does this mean? Um, what does this mean, really?
I think this Zika virus, it came into like sort of causing havoc probably in around 2016, 17. Before that, we didn't hear about Zika virus at all. And that it's a mosquito borne disease. And if someone gets Zika while they are pregnant, there is a high possibility that baby will have very small skull, or the like the head.
Cranial, yeah.
And yeah, or the brain box, or whatever you call it in normal English. And if the skull is small, your brain will not develop the way it needs to develop. So therefore the baby will have um, some mental retardation. And UK law is very strict about that. And that's why we always advise people when they are going for fertility treatment that choose your travel destination very carefully, going through the CDC website, where there is all the countries are listed, and they will have like what is the Zika risk, uh, check it. Because otherwise, if you travel someone like Florida has got minimal Zika risk, but even then, if you visit Florida, have your dream holiday, you will come back and the consultant will say, I'm sorry, you need to wait for 3 months from the day of your return, because of that risk. And UK government has got very pragmatic view on that. You might, India is a Zika affected country, and people are falling having their baby at India. So what about that? People question that. We don't know. We are in UK, we have to follow the UK rule. Because if any fertility clinic essentially denies that regulation, and 10 years down the line a couple comes back and says that we had treatment, now baby has been diagnosed with this, and that's probably related to Zika, why you didn't tell us, why did you allow? Lot of couple asks us, can we not do some blood test? Now when we check opinion from the virologist, we have been told these are the test. Yes, currently it looks like it's all foolproof, but health, like all the investigation related to any condition are changing. And therefore it might come back in 5 years, 10 years time that these investigations, Zika virus blood tests, they were not foolproof, you are missing something. And then where do we stand medico legally? We will not be able to kind of defend ourselves, and it's not safe for the couple. And in the long plan of whole thing, 3 months is probably not a lot.
Yeah, in the grand scheme of things,
Yeah.
absolutely. If you allow me, I just got another question which came to me on WhatsApp. So sorry for the interruption if you heard that. But somebody asked me, a lot of people think that IVF is having a designer baby. That is, you get to choose the sex of the baby, you get to choose how they look, or, uh, you know, um,
Not in UK.
very not in UK.
Absolutely.
And
Because
exactly, yeah,
designer baby concept came, I think it's mainly from America.
yeah.
And the fertility treatment and IVF practice there is completely different. In UK, we, as I said, UK is probably the country where we have strictest rule about IVF. And it's called like pre-implantation. We get that question, can we choose the sex of the baby? The answer is no. Only scenario where you will be tested if you have history of recurrent losses, you have chromosomally abnormal baby in previous pregnancies, then you will have pre-implantation genetic testing to rule out what we call Down syndrome, Turner syndrome, etc. And also, if you kind of have history of some hereditary disease, or you carry some specific gene for cancer, like we all know for breast cancer gene,
Yeah.
gene, and all this, in those cases, you have the right to choose the embryos without those genes, so that you break that genetic linkage of those hereditary disease. But it's completely up to the couple. Lot of people I have seen who will say, yes, I know you, I can have the choice of going through that journey and NHS fund that, but I don't want it. But that's completely their personal choice.
Yeah, and I think that's the ultimate goal. It is a personal choice. If people want to, conceive naturally, uh, or with with the help of whatever tools are available, or if they don't want to, that is also a personal choice.
Yeah.
The last, I think, a little bit tangential to the last. I'm sorry, I never end. But so when you said that when we in the UK there is a limit of the number of embryos that are implanted, or the number of
Yeah.
yeah.
Again, the UK rule for NHS funded treatment below the age of 35, we can put a single embryo back in the first cycle. That's
Ah,
the policy. Reason is, when we put two embryo back in the self-funded patient, we have that flexibility, but maximum up to two embryo up to the age of 40. But when you put two embryos back, you do not double your chance of success. If you look at HFEA website, it will just increase by 1%. But when you put two embryos back, your risk of multiple pregnancy, less than 1% with one baby, can go up to 15%. So that's why, which option you will take, putting two embryos in two successive cycle and each time having 45% or 40% chance, or just 46% chance in one go? The answer is simple. You will take two chances rather than one, and it's cost effective as well. You are creating the embryos from very first cycle. You have got two embryos and you are getting two transfers if needed to be. But saying that, I will tell you a story. Not last year, year before. One day I was in a clinic and one of the nurse came through my door and said, Arpita, that patient posted in the Instagram that she is having three babies. And first question I said, how many did I put back? And answer was one. So one can split into
the
three,
three.
and it's not an easy journey.
Yeah.
So therefore, single embryo transfer in your first cycle, if you are less than 35, that's the way forward. Above 35 to 40, we are a bit more flexible to put two embryos back. And above 40, HFEA allows three embryos, but in my 17 years of fertility career, I have put three embryos back only two times. So it's that,
Wow.
only two times. And yeah, so it's very, very rare. Whereas if you look at America, you hear those story of six babies, seven babies, eight babies, and that's not safe.
Yeah, I think that's a good disclaimer to have, that from the medical from a medical point of view, because that is again the kind of stories, a kind of myth that is propagated with IVF, that you go in and you come out with three babies,
Not
and
unless you
exactly.
are very unlucky, like that lady. And in the journey, we followed her
Lucky
journey. She
or
lost
lucky.
one
Yeah.
baby,
Oh, sorry. Yeah.
and two babies was staying in the special care baby unit probably for 4 months. And that's not
Oh
easy.
dear.
3 to 4 months.
No.
So all the babies were delivered by 25 weeks. Then one lost at around 27, and the rest, I think, like went up to full term in the special care unit. But you are taking huge risk.
So thank you for clearing that up. In the interest of time, I think we would need to come. We would need to end with the questions. So I kept on getting WhatsApp messages till 5 minutes ago.
Right?
We would like to probably do another session with you if that's all right, and we'll time it for a day convenient to you, and come back with the rest. Again, following the same pattern that we did today, we would give people enough notice, maybe 3 weeks, to come up with any question. Um, a disclaimer that I would like to probably put forward is the opinions and the medical procedures discussed here are clearly of the subject matter experts, and that here is, of course, Arpita Di. Um, the other thing is this is an ongoing series, and this is our first episode. We aim to continue this, make it a monthly series, and every month we will be looking at a different health and wellness issue. So, if there are health and wellness issues or questions or any topics that you would like to discuss, then we can arrange that for you. You just need to give us some time, because we would also be looking for our resources, and we would still make them a very informal and easy conversations. There is no questions which are barred, and please be assured that we will keep all the names. um, we will never publish any names or anything like that. Anything to add, Orpitati?
No, I think the first episode went well. Hopefully, it has cleared few things which people may have there in their mind they were thinking. So yeah, until then, we will say goodbye to everybody and have a good evening. And thank
Bye
you, Meg.
bye. Yeah.
Bye.
Thank you, Orpitati. Bye.